You know what strikes me most after all these years working with patients? Not the complexity of injuries, not the advanced cases, but how people make the same mistakes day after day, year after year, without even suspecting it. And these mistakes slowly but surely destroy their knees. Then they come to me and say, "Doctor, where did this pain come from? I didn't do anything special." Exactly. You did, but you did it wrong. Your whole life. Let me start with the most banal thing, how you walk. Yes, exactly, walk. You think walking is a natural movement that doesn't need to be learned? You're wrong. Look at small children who just learn to walk. They walk correctly. Their knees are slightly bent, feet land softly, weight transfers smoothly. Now look at adults on the street. Most stride, straightening the leg at the knee completely with each step, literally stabbing the heel into the ground. With each such impact, a shock wave passes through the knee straight to the hip and spine. Last month, a woman came to me, 47 years old, complaining of chronic pain in both knees. Examination showed nothing critical, slight cartilage wear corresponding to age. I asked her to walk around the office and immediately saw the problem. Each step she took with an absolutely straight leg, knee locked in extreme extension, heel crashing into the floor like a hammer. I asked, "Do you always walk like this?" She was surprised. How else? Is there another way? I showed her proper walking technique. The knee should remain slightly bent throughout the entire step. When the leg goes forward, the knee is soft, not locked. When the foot touches the ground, it happens smoothly, starting with the heel but without impact. Weight rolls through the entire foot. Knee absorbs the movement. It seems so simple, but requires awareness. A month later, she returned and said pain decreased by about 70% just from walking correctly. She retrained herself every day. The first week was difficult, had to constantly control herself, but then the new pattern solidified and her knees finally stopped receiving thousands of micro impacts daily. Now let's talk about how you sit. Most people spend 8 to 10 hours a day sitting, and most sit catastrophically wrong. The most common mistake is sitting with crossed legs or leg over leg. When you sit like this, you create uneven pressure on the knee joint. One knee is compressed by the weight of the other leg, circulation is disrupted, ligaments stretch unnaturally. Even worse is sitting with one or both legs tucked under you. Seen how people sit on a chair with foot tucked under thigh? It looks comfortable, but the knee is in an extremely unnatural position. Ligaments twisted, meniscus pinched, cartilage compressed. An hour or two in this pose and you get up with difficulty. The knee needs to be walked off. The correct sitting position is actually boring. Both feet on the floor, knees bent at right angle, thighs parallel to floor, weight distributed evenly, no twisting, no exotic poses. Yes, it's less comfortable at first because your muscles got used to wrong poses and relaxed, but it's the only way to keep knees healthy with a sedentary lifestyle. And how do you get up from a chair? Most people do it by throwing their torso forward and rising on almost straight legs, all load going to knee joints. You need to get up differently. Move to the edge of the chair, place feet slightly back under knees, lean torso forward, transferring weight to feet, and rise using glutes and thighs, not knees. Knees remain over feet. Don't go far forward. Stairs. Oh, how wrongly people walk on stairs, especially going down. When descending, most literally fall from each step onto a straightened leg. The entire body mass crashes onto the knee joint. Imagine what happens to cartilage with such impact, especially if you're overweight. Proper stair descent is controlled movement. The leg lowering to the lower step should be slightly bent at the knee. You lower smoothly, controlling movement with thigh muscles, not just dropping weight. Yes, this requires more effort. Yes, it's slower, but your knees will thank you in 10 years. Stair climbing also has its tricks. Main mistake is leaning forward and reaching with the knee upward. Correct is keeping torso more vertical and pushing off with the heel using glutes. Knee moves up but doesn't go far forward past the toe. Now about squats. seemingly a natural movement. But look how a modern person squats. Knees go far forward, heels lift off the floor, back rounds. All weight hangs on knee joints. This is catastrophic for knees, especially if you squat like this every day, picking something up from the floor. Proper squatting starts not with knees, but with pelvis. You push pelvis back as if sitting on a chair. Knees bend, but stay over feet. Don't go past toe line. Weight on heels, back straight. When you rise, you push off with heels using glutes and thighs. Knees straighten last. They simply follow the movement, not dragging all the weight. I had a patient, a physical education teacher, imagine that, 41 years old, athletic, active, came with right knee pain that tormented him 6 months. I asked him to squat. He squatted exemplarily by all bodybuilding canons, deep, knees forward, quadriceps on fire. This is how I teach children to squat, he said proudly. This is how you're destroying their knees, I replied. I retrained him to squat correctly with emphasis on pelvis and glute work, not quadriceps. After 3 weeks, pain disappeared. He was shocked. His entire career, he taught children wrong technique, squatted wrong himself, and ended up with chronic patellofemoral syndrome. Let's talk about running. If you run, you likely run wrong. Most common mistake is heel strike with straightened leg in front of body. This creates colossal impact load on the knee. Proper running technique is midfoot landing. Leg at ground contact is under center of gravity. Knee slightly bent and absorbing. Another catastrophic habit is sitting in a squat. Yes, I know in some cultures this is normal, and people can sit like this for hours. But if you didn't grow up squatting from childhood, if your ligaments aren't adapted to this, prolonged squatting is huge load on menisci and posterior knee structures, especially on hard surface. Know what else people do wrong? Stretch. Everyone knows stretching is beneficial, but most stretch knees wrong, creating load on ligaments instead of muscles. Classic example, sitting on floor, legs extended, person reaches with hands or toes, knees locked in full extension, ligaments of posterior knee surface overstretch, and hamstring muscles don't really work. Properly stretching hamstrings needs slightly bent knees, focusing on sensation in muscles, not joints. If you feel stretch behind the knee, you're doing it wrong. Should pull the muscle, not ligaments. And last, but very important, how you sleep. Many sleep on their side with pillow between knees. This is correct. This supports neutral position, but some sleep with legs twisted in incredible configurations, one knee over another, thigh turned inward. After a night in such position, knee swells and hurts, and person wonders why. If sleeping on side, pillow between knees is mandatory, if on back, can put bolster under knees for support, if on stomach, better not sleep on stomach at all. It's bad for everything, including knees, because legs often twist unnaturally. See how much? And I haven't even mentioned wrong shoes. The habit of standing with weight on one leg, how people get into cars twisting the knee. Each of these actions by itself seems insignificant, but you do them thousands of times every day for years. And each time your knee receives microtrauma, microstress, wrong load. Cartilage doesn't wear from falling once or squatting unsuccessfully once. It wears from walking wrong 20,000 steps a day, from sitting wrong 8 hours a day, from getting up from a chair wrong 50 times a day, from going downstairs wrong, squatting wrong, running wrong. And then you wonder where the pain comes from, where arthritis at 45 comes from, where inflammation comes from. And it comes from there, from thousands of wrong movements accumulated over years. Good news is this can be fixed. The brain is plastic. Movements can be retrained. Yes, at first, it will be difficult, unusual. You'll have to consciously control every step, every squat. But after a few weeks, new patterns will solidify and correct movements will become automatic. I've seen people who got rid of chronic pain simply by learning to move correctly, without pills, without injections, without surgery, just by retraining their body to do what it does every day, but do it right. So if your knees hurt before running for pills or to a surgeon, stop and think. How do you walk? How do you sit? How do you stand up? How do you squat? Perhaps all you need is to learn to do these simple things correctly, and your knees will stop crying for help because they'll finally get what they need: proper physiological, careful movement.